My name is Alex Wade. I'm an emergency coordinator with Médecins Sans Frontières in Ukraine. The situation across the country is becoming more dire every day. We're doing our best to monitor the humanitarian needs across the country, but this is a major challenge because they are changing and growing so quickly. Our highest concern today is the situation in Mariupol. The city has been heavily shelled day and night for the last several days. There has been shelling in the center of the city, and on the outskirts, the damage is even worse. There's been supermarkets that have been hit. People having no other access to food have taken food from the supermarkets, which are almost completely empty. The pharmacies are almost completely empty. There's no electricity, which means no heating, and there's no water. We have direct contact with our staff, our colleagues, people we've known and worked with for years who are there, who are communicating these needs to us. They don't know where they can get water. People are drinking rainwater or collecting snow for water. People have literally broken into heating systems to take the water from heating systems to be able to wash their hands. If the situation is not addressed immediately today, tomorrow, in the coming days, there is going to be a serious emergency and a possible disaster. When the war started, we had to immediately halt all our other programming in order to switch to emergency needs. It was also no longer safe to continue with the ongoing programs we had. We fortunately had some emergency medical supplies pre-positioned in the country, which we were able to quickly donate to hospitals that are receiving wounded, specifically in Mariupol and Kyiv. However, these supplies we had already in the country are almost fully exhausted. So right now our top priority is getting more supply as quickly as possible to the hospitals on the front lines of this conflict that are receiving wounded. Many of these hospitals are in the zones of active fighting. Their needs are increasing as they receive wounded, but their supply chains have been disrupted. We are in direct communication with many of these hospitals who have confirmed to us that they've received dozens, in some cases over 100 wounded, and they have communicated that they're in danger of their essential medicines and essential supplies being in rupture so that they cannot continue to treat the patients they receive. This is why sourcing these hospitals with essential medicines and supply remains our top priority. Outside of the direct results of this conflict, you have the entire host of regular urgent medical needs found in any population. You have people who need access to insulin or other treatments for chronic diseases such as hemodialysis. You have pregnant women who need access to safe delivery. You have people with mental health needs. These are all conditions that, if access to care is interrupted, can lead to serious complications and even, in worst cases, death. We're incredibly worried about the needs we are seeing develop on the ground. And for us, the most important thing right now is to continue to have access to all of the communities, all of the populations affected by this conflict, so we can continue to support their medical needs. For the population in Mariupol, we really want to see and need to see a solution immediately. Civilians must not be trapped in a war zone. People seeking safely must be able to do so without fear of violence. Whether they choose to leave or choose to stay, the civilian population must be protected.